Welcome back to Session Notes Unfiltered, the podcast where we talk about ABA the way it actually happens, not just how it looks in the textbook, from the perspective of an honest RBT. If you're a BT, RBT, BCBA, BCABA, parent, caregiver, or anyone who's ever written client engaged in tantrum behaviors throughout session, this episode is for you. Today we're talking about common behaviors we see in session and how to navigate them in real life. When the client is tired, the environment is chaotic, and your reinforcement just stopped working for no apparent reason. We're going to start with tantrums and emotional escalation. This can often look like crying, yelling, or dropping to the floor, can sometimes become aggression towards themselves or others, throwing items, property destruction, task refusal that escalates into a full meltdown. And the unfiltered truth is not every tantrum is manipulation. A lot of the time it's communication, frustration, or pure nervous system overload. How to navigate it? Pause and assess the situation. Ask yourself, why now? Is it the transition? Is it denied access to an item? Was the demand too high, too hard? Lower demands temporarily may feel like you're giving in, but it's just regulation. You're helping their nervous system to calm down and make them feel a little more confident again. You can narrate calmly, I see you're upset. We can take a break, then try again. You can reinforce recovery, but don't reinforce the escalation. We do not want to feed into that energy when they're at the peak of their tantrum and that behavior. That will reinforce it even if you're not trying to. If you are overreacting, and I mean that in the way of you are being very reactive in the way of you're kind of coddling, that's reinforcing. That's like you're rewarding it. If you stay calm, that gives them the lead and they can follow. Oh, they're really calm right now, even though I'm acting like this. Maybe I should calm down. Like, maybe it's okay. They don't seem freaked out, kind of feeling. But if you're going a little overboard and you're baby talking or just really having the wrong reaction, that can negatively reinforce what you're trying to avoid and work on. Sometimes the win isn't completing the task they were working on, but it's helping the client calm their body and re-engage. Next, I want to talk about elopement, which can either be as serious as running away or as tiny as just leaving the designated area. This often looks like the client running to the kitchen, to the bathroom, their parents' room, living room if they're usually in their room, or vice versa. Walking away mid-task, or bolting when demands are placed. The unfiltered truth is elopement is rarely about defiance. It's often escape, access, for lack of functional communication. I've had many clients try to elope when their caregiver leaves. Their parent can go to work or go to the store, and I'm with other family members if this isn't home. And I've had a few who try to follow them out the door. They can't communicate that they're upset or where did they go. They just scream like they're getting seriously injured, try to run out the door. I've had some be so quick they did get out the door, and I'm lucky that me and the caregivers are very fast and nothing happened. No one got hurt. They were stopped on their porch every time. And the safe way to navigate that is basically that. You block safely when it's needed, but you don't turn it into a power struggle. You don't want to fight with anybody. You teach replacement mans like break or help or all done. One of my favorites is to just, even mid tantrum, mid crying, I like to redirect to one of their calmer toys, calmer plays. Like some will love to draw in these instances, and that will distract them greatly and transition from a very escalated upset level to within a few minutes, usually, even sometimes as short as a minute, just calm and hugging me, actually, which is really cute. I've had some who really love to read in these moments, and that's a good distraction. So if there's like a calm, coping kind of task you can do, those are the good ones for those moments. You can reinforce staying, even if it's short, brief, reduce the task length, and build your momentum. If every demand feels like a trap and it's not fun, elopement becomes the only escape. Next, I want to talk about task refusal and avoidance. This often looks like ignoring prompts, saying no, or pushing materials away, sitting silently, or flopping. The unfiltered truth: task refusal is data, not disrespect. How to navigate this? You can check. Is the task developmentally appropriate? Has this client already had a long day? Have they done this task already today? And even if not today, have they done this task at all this week and maybe they need more options? Use behavior momentum by doing something easy and then raising the level. Bit by bit, make it harder. You can offer choices using first then. You can say first we do this easier preferred activity or option, and then we can do that. Shorten tasks, increase reinforcement. If you wouldn't want to do it after a long day, neither does your client. Then we have aggression or property destruction. This often looks like hitting, kicking, throwing items, grabbing materials aggressively, biting, smashing items on the floor or with other items, ripping up things that were not meant to be ripped up. The unfiltered truth: His aggression is often a last resort communication. You can navigate this by putting safety first, always, for you, the client, anyone that could possibly be in harm's way. Stay neutral and regulated. Your tone does matter. Reduce stimulation. Redirect to functional alternatives. Reinforce appropriate attempts, even imperfect ones. Our calm teaches regulation more than any prompt ever could. If we are freaking out, similar to what I was saying earlier, if we are freaking out or we are overreacting, that's not going to help them to calm down. We have to show them that reaction. We have to show them that behavior and response. We have to teach them by modeling coping strategies. And even though we can also be frustrated in these moments, because it's not fun to be getting hit, kicked, spit on, bit, whatever they're doing, it's not fun to do. It's not fun to have happen when you're at work, or if it's your child, for them to do it to you, themselves, whatever the situation. But if you react too much, whether it's positive or negative, they are learning, they're going to get a big reaction out of you every time they do that. And sometimes, even when you're giving them a negative reaction and you're mad and you maybe yell, something in them is going to want that. They're going to learn, they get a reaction, they get attention. If they're seeking attention, now they know how to get it from you. So you have to keep your cool, use your words, use your calm voice. If you need a minute, if you need to take a few deep breaths, do it. That's actually really helpful for them to see you doing, especially if they start to calm down and can hear you doing it. They will start to learn to do that themselves. They will see you reacting in a good, calm manner that's helping to regulate your own nervous system, and they will feel that calm and they will follow. Next, I want to talk about potty refusal and toileting behaviors. This often looks like ignoring potty prompts, eloping from the bathroom, or accidents despite being ready and knowing how to use the potty. The unfiltered truth: toileting isn't just a skill, it's sensory, emotional, and environmental. Everyone listening to this was a kid once, and I know most of us, from talking to others growing up throughout my life, that we don't all feel comfortable in a public setting when we're going to the potty, right? A lot of us had nerves about that when we were young. I feel like that's very common. Imagine having that, which is something I believe most, if not everyone, has at some point in their life. And then on top of that, you're having the sensory issues of how weird everything feels and how you don't want to feel wet or you don't want to feel dirty, and not understanding fully how to do those things for yourself yet. It can be really overwhelming. A way to navigate that is to keep prompts neutral and consistent, avoid power struggles, reinforce attempts, not only the success, and respect autonomy while following the plan. This is a very important experience and skill to learn for the rest of their lives. We do not want it to be paired with trauma in any way, shape, or form, that they are linking trauma from whatever you're doing incorrectly to using the bathroom. It's going to make your life harder working on this with them for however long they may take. It's different for every kid, but it's also going to make it much harder for them than it is for anybody. And a lot of the children I have worked with who are going through this can't talk to you too much about what they're feeling or what they're worried about. They don't have the understanding or the words yet to tell you those feelings. They're just feeling a lot of things and they're overstimulated. And it's okay. That's what we're here for. If you're listening to this and thinking, I had all of these behaviors today, I dealt with all of these things today, this week, you're not failing. You're doing ABA, and you're doing a good job. Progress isn't always data points going up. Sometimes progress is fewer tears, faster recovery, or a client trusting you enough to try again. Sometimes the progress may take a back step, but that never means you're failing. That means they probably just need more consistency, whether it's you, the family, the BCBA. Success and progress thrive with consistency. Session Notes Unfiltered exists because the work is hard, the behaviors are real, and the people doing the job deserve honesty and support. I made this podcast because there are a lot of little things that I see that go wrong, and a lot of them are very common from home to home. And I never want to say any of this as an attack on anyone's parenting or on anyone's way they do their job. This is always said to be helpful, whether you're doing these things incorrectly, you're doing these things right, and go you if you are, or if you just have seen this and you get it and you relate and you understand. I just want some people to know they're not alone, and also try to give some advice if I can. If this episode felt validating to any of the things I've shared and that you feel similarly and you felt seen, please share it with one of your friends, an RBT, BCBA, whoever you think needs to hear it. The last few weeks with one of my clients, I've had some very back and forth behavior. The data's been all over the place. Some things are graduating out of them. Some things we're mastering. Other things are coming back and we had mastered them, but they're back. Some things about to be mastered and now they're almost at a zero. Consistency matters. When I met this client, the behaviors were decently high compared to a lot of other kiddos I have met. They weren't terrible. I feel like caregivers being overwhelmed with their own things, so sometimes being a little lazy and slacking on the plan and the consistency has created many more behaviors for this particular client. A lot of it is tantrums and elopement. In the past 2 weeks, I have gotten hit and kicked a lot more than usual. I've also gotten a lot of hugs as well. This kid tells me they love me. Is it the easiest job ever? Not every day. Some days are pretty easy. And then some days are like that. But I still want a home. I still want to be there to help that child work on those things. I still want to help the family navigate that. I still want to be the eyes and ears for my BCBA because I am there and she is not. So I have more information on the behaviors that are happening and the ABC data on why and what happens after. If we aren't all on the same page, if we aren't all treating it with some sort of calm coping mechanism, if we're giving a treat or a lot of attention or a preferred item while that is happening and the behaviors are that high, we're really not teaching them what we want to. And it is hard, but it's really worth it when you do the work. So until next time, document honestly, reinforce generously, and give yourself some grace because you deserve it. And you're doing a really hard job pretty well. This is Session Notes Unfiltered, an ABA podcast, and I am Miss B, signing out.